Welcome to EAU podcast series, Exploring Urology, a Roadmap for Medical Students. In this 7th episode, Opportunities Beyond the Clinic, Leadership, Academia and Advocacy. We are joined by Mrs. Sarah Collen and Associate Professor Juan Gómez Rivas. They discuss the variety urology offers beyond patient care, including leadership roles, academic research and global advocacy. Whether you're considering urology as a career or are simply curious, join us as we uncover why urology is an essential part of modern healthcare and an exciting career path.
Welcome back to Exploring Urology, a Roadmap for Medical Students. I'm your host, Juan Gómez Rivas, and with me is Sarah Collen. Sarah, can you introduce yourself to the audience to this podcast?
Hello, everybody. As Juan has said, I'm Sarah, and I work for the EAU as the policy manager. I'm based in Brussels, and I'm involved on a daily basis in the advocacy work conducted by the EAU. I have a disclaimer, I'm not a urologist, I'm more of a political scientist, but I work under the leadership of EAU members. And Professor Van Poppel is the current chair of the office.
We love to hear that you are not a urologist because we sometimes need to listen to people that is outside our specialty to make us think outside the box and to see what other opportunities we have beyond what we do in our daily practice in the hospital. So today we're excited to dive into the episode of our podcast series, Opportunities Beyond Clinic, Leadership, Academia, and Advocacy in Urology. So many medical students see urology as an unknown specialty. As a matter of fact, we did a survey some years ago in the European Society of Residents in Urology, and we found out that around 15 to 20% of medical students didn't even went into urology when they were in the med school. But today, we're going to go broaden in that view, highlighting the roles that allow you to make a major impact, not only in your hospital, but also in leadership, academia, research, and even global health advocacy. Through this episode, we will be answering some of the most common questions that students you have asked about this alternative career path in urology. So we can get started with our conversation.
That's really great, Juan. And let's perhaps focus on the leadership opportunities first. Leadership, it sounds like one of those things that comes into play when you're really established in your career, perhaps when you want to go for heading a department. Is that the case?
So actually, no. Leadership opportunities can start much earlier than you think. Many urologists lead from the get-go, whether it's a chief resident, a department head, or even leading in the national or international medical societies such as the EAU. Many national and international societies has young committees or sections and office when you can start your career as a leader in an early stage. Leadership is not just about formal titles either, it's about initiatives. For example, you might organize a conference panel, lead a research project, mentor younger urologists, and this role doesn't mean that you always require the most senior one in the room. Leadership is often about making a difference just where you are.
So what skills do you need to be a good leader in medicine?
That's a good question, Sarah. Being a leader in urology, and not only in urology, perhaps this fit for any medical field, requires a combination of medical expertise, management skills, and emotional intelligence. To know how to mentor others, make decisions in complex situations, and inspire challenge. Many physicians who are interested in leadership roles also pursue additional training. For example, fellowship master or courses in healthcare management to shape their skills in areas like finance, team management, strategic planning. And there are many non-technical, non-surgical skills that the doctors need in order to shape this for their careers.
That's a really helpful tip that, to take part in trainings outside of surgical training. Perhaps we could move on to research and academia, teaching, academic leadership. These can be really fulfilling ways to influence the next generation of urologists, of urological care. But is it really worth it in terms of your clinical career?
Sure. Academia offers a wide range of roles, and teaching is just one part of it. So many urologists need to find a balance between their clinical practice and the academic work. You might teach a class or two, but at the same time, you need to save time for researching or developing new surgical skills. When you become a doctor, you need to always think about what are the new things coming, because you need to be updated. And to be updated, you need to be inside to academia. For example, imagine being the person who is breaking through a new device for robotic surgery or helping to develop a new prostate cancer treatment pathway. So this kind of impact, you can make it through research only. Despite that, also academia offers the chances to mentor students and residents, which can be just as rewarding as performing surgeons themselves.
Thanks, Juan. And how can you get involved in that kind of academic research that you're talking about, even as a student?
As a student, you can start by seeking out research opportunities with your medical school or hospital. Many universities has summer camps, research programs, or offer projects that allow the students to collaborate with senior faculty. Even if you are assisting with data collection or literature review, it's valuable to get your foot out the door. Also, learning clinical and critical research skills that will be essential if you decide to pursue academic career down the line. It's very, very important.
So speaking of research, I mean, this is where innovation really takes center stage. But I often hear from people that you sort of get focused down a track of interested in surgery and surgical skills. Do we really need to get involved in research to be successful in urology and in urological careers?
That's a common concern. And the quick answer is that depends on your goal. While research isn't mandatory for all urologists or for all doctors, it certainly opens up doors. If you are interested in becoming a leader in academics or cutting-edge clinical settings, research experience is crucial. Plus, urology is a field where advancement happens rapidly. So contributing to research could mean being part of the next big breakthrough in surgical techniques or treatments. You don't have to be in the lab full time. Many urologists integrate research with the clinical practice, working on studies that align with their specialties. For example, you might investigate the long-term outcomes of a new surgical methods while you are still in the operating theater, for example. So, Sarah, you are part of the advocacy team at the AAU, and you have a very large background in advocacies. I don't want to take the whole podcast for me. So now it's your turn to talk about advocacy. We have talked about leadership. We have talked about academia. And this has led us to think out the box of our clinical practice. But can you explain us what is advocacy? What does it mean? And how can we get involved in advocacy in a very early stage of our careers?
Yeah, thanks, Juan. I mean, advocacy is a bit of a weird word, and it sounds as though you have to be a lawyer to be able to do it. But actually, advocacy or being a health advocate is not at all about being a lawyer or a political scientist. It's about being engaged in calling for a political commitment or in mobilizing resources or making effective policy changes or even legal changes to support a particular health aim. And as such, it is becoming a really important competency for not only for urologists, but more broadly speaking, for the medical profession. I think professional qualifications in the past used to be purely about medical, surgical skills. And we're seeing a gradual but an increasing shift, looking beyond those purely medical competencies that must be obtained, but also talking about some of the competencies that we're talking about on this podcast around leadership research, but also this role of clinicians, surgeons as health advocates. You know, in that sense, this is something that becomes part of your career, even from a very early stage. It means, I guess, if you're a health advocate as a urologist, if you have a competency as a health advocate, it means that you're aware of some of these health determinants that impact the lives and the health of your patients before they even walk into your clinic. And it means that you seek to make changes for the better, not only for individual patient lives, but also for society and for better health in broader terms.
Can you, Sarah, give me a concrete example on what you are meaning about impact the life of the patients and seek of change, which, of course, when you hear it, is beautiful to hear that, but can you give an example to see what are you talking about?
Yeah, I was trying to think about this. And I'm going to, firstly, I'll just use a hypothetical example, I think, just to demonstrate what I think advocacy means. And then I can maybe a bit later to talk about what the EAU does. But to give you a concrete example, you as a urologist, you could be faced with having to give a diagnosis, for example, to a woman who has been suffering from hematuria for over 18 months. And she's come into your clinic and you've done the investigations and you've done everything by the book, but you're faced with having to give her a late stage bladder cancer diagnosis. And on speaking to her, you find out that she's retired now, but she was a hairdresser all her life, and you learn that she smokes. And so when you see that patient's lives, you become aware that there are things in her life that might have increased her risk of getting cancer and also being diagnosed, and you having to face giving that diagnosis essentially at quite a late and maybe even too late phase. Maybe she was in contact with carcinogens, with chemicals that might have impacted her likelihood to her risk of bladder cancer as a hairdresser in the past. You know that smoking has increased her risk of cancer in general. The fact that she's been having hematuria for 18 months, either she's been stuck in primary care without being moved forward, or she hasn't even gone to her GP. She doesn't realise that this is an issue. So there are loads of things here that have hit her life before you even got a chance to see her in clinic. So being a urologist, a health advocate in that situation, well, there are lots of things that you could potentially be involved in. It might be that you're looking to make sure there are bans or at least a reduction of carcinogens in the workplace, or that at least workers are protected from these dangerous chemicals. You might want to become involved in calling for robust tobacco legislation to protect people from the damages of smoking. You might even want to look into what's going on with primary care, support your primary care colleagues with guidelines for hematuria. Maybe they don't exist in your country or your setting, seeing where the gaps are, and thinking about health literacy as well. Is there enough information going from your health system to the citizens to raise understanding on, for example, bladder cancer and its risks? So for me, that's an example of the sort of lens that you apply as a health advocate, as a urologist, or that you might apply.
Thank you for the example, Sarah. And the European Association of Urology as an organization, what is doing now about advocacy? What are their plans? What is coming in the future for the EAU regarding this?
Yeah, thanks, Juan. So we as the EAU, we focus mainly on the activities that can be achieved best at EU level. So working together with the different national societies on the big issues that are better addressed together. We deal with oncological issues, but also benign conditions. So on cancer, for example, we've had a big policy campaign on the early detection of prostate cancer. When we were examining the status quo and thinking about advocacy, we really saw that opportunistic screening was not as effective as it should be. We're not catching the men that really could benefit from early detection. It's also putting a strain on health systems, partly because it's currently so unorganized and difficult to plan, but also because late stage prostate cancer is so costly, and also it's a terrible quality of life for prostate cancer patients themselves. So we began a policy initiative around that. We spoke with the European Commission. They listened to us. And as a result, we have an EU recommendation that includes prostate cancer screening on the list of cancers that could benefit from screening programs. This is really positive. On top of that, we've received EU funding to start piloting prostate cancer screening programs in different European countries in different contexts. And we, as the EAU, we lead that EU-funded consortium. Talking about a non-oncological issue, we're also working on continence health. So we're raising awareness on the subject of urinary incontinence and the impact that has on people's lives and on society. And it's one of these subjects, unlike oncology and cancer, that gets quite a lot of press, that has hardly any policy or press coverage at all. What we did to start raising awareness on this was to commission a report, actually not by us, but by health economists. And they found that about 60 million people are impacted across the EU, and it's costing us enormous amounts of money. It costs 70 billion in 2023, and that cost is set to rise by 25% by 2030 if we do nothing about it. Alongside commissioning this report, we worked with other stakeholders, with patients, with other specialties, and decided and developed a 10-point plan, a manifesto for action, so that we can reduce the burden and better manage and prevent these conditions. And it's a really good example of how we work, not only just as urologists, but with other stakeholders. We directly engage not only with the civil servants and those policy wonks that write the policy documents, but also with politicians and with Europoliticians to see if we can shape the agenda.
Great, Sarah. It's very good plans and very good movement from the EU, impacting not only, of course, mortality or survival of patients, but also in quality of life, which is impaired in patients with urinary incontinence. We are almost finishing the podcast. So what would be your closing remarks for medical students about exploring advocacy, exploring academia, exploring leadership, exploring beyond the box that they have in their clinical practice?
Yeah, I guess for me, my take-home message, would be that advocacy is a team sport. One voice alone with anybody is often drowned out. So if you're interested in health advocacy, if that's piqued your interest, start reaching out to colleagues, to other people from other specialties, to patients, and think about how you can work together. But a really good person to start with is me and the policy office. And we'd be really delighted, if you're interested, to help you develop your skills and your competencies in this area.
Thank you, Sarah. My advice as an urologist to those that are in an early career stage is to not wait, to start exploring this very early. Get involved in research, get involved in academia, get involved in all these initiatives. As you said, you need to find mentors, and also medical students and young urologists should take advantage of leadership and opportunities that come their way. The earlier they explore these areas, they will be more prepared in the future, and they will be more prepared for taking more important or more bigger roles when they grow in their career path. Thank you very much for the listeners of this podcast on exploring urology. I hope this episode has inspired them to think beyond the clinic and explore many ways they can make an impact in the urology and also in other clinical specialties. Thank you very much.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.